Can machines learn to do doctor work? The future of the war on diseases. Here's an overview. We will go through the motivations. I'll ask you if you can tell the difference between two x-rays. We'll talk about misdiagnosis, a study done by Stanford, my current study, convolutional neural networks, my recommendations, as well as my future work. So the motivation here is to help extend life expectancy for humans. At the forefront of most humans, they want to live a long and healthy life, so I feel as though this is a way to help that. Shed knowledge on the beauty of data and medicine together, and also to help get the best predictions and diagnosis of disease while generating it in real time. Would you be able to tell the difference between these two x-rays? Which one has pneumonia? I'll give you a few seconds to have a look and have a think and make your decision. If you said the image on the right has pneumonia, then you would be correct. It's very hard to tell if you haven't been trained which has and which does not have pneumonia. Hence why you'll see what we'll talk about in the next slide. Misdiagnosis. Pneumonia is the second most misdiagnosed condition leading to readmission, and it's usually due to one of two reasons. The doctor diagnoses you with a different, less serious condition leading to worsening infections, or the doctor diagnoses you with a different, more severe condition. A study done by Stanford in 2017 was called ChexNet. It was a 121 layered convolutional neural network trained on the chest X-ray 14. At the time, it was the largest publicly available chest X-ray dataset at the time. And what the experiment was they tested radiologists, several radiologists on X-ray patients with pneumonia and other various respiratory conditions, and tested the chest X, the convolutional neural network, to see which will perform best. And the radiologist F1 score average was 0.387, while the chest X net F1 score was 0.435. So you can see there's quite a big difference in between the F1 scores. My current study is I'm also using a convolutional neural network with 11,700 images, and there are all images of people, normal people without pneumonia, and then X-rays with pneumonia. And I was able to get my score to 93, and the highest I had seen this far was 92. So I'm very happy about that. Briefly, a convolutional neural network is a deep learning technique that can be used for image classification. Computers and neural networks are very good at recognizing patterns. So this is why we were able to have such a high accuracy when recognizing the X-rays with pneumonia versus the ones without. My recommendations would be to utilize the vast amount of medical data that we have. We have a plethora of data that dates back for decades and decades. So now that we have the computational power as well as these algorithms, we should utilize the tools that we have, because if I was able to just get a 93% accuracy with only 11,000 X-ray images, we would be able to do so many more with all of the data that would be accessible to hospitals and doctors. Use both algorithms as well as doctors. I feel as though it's always good to double check and have a backup plan if it doesn't work. And I would think you would want the most possible ways of being better. So if a doctor does well and an algorithm does well, then you have a better chance of being okay. Also, take a survey of sentiment of doctors versus machines. See how comfortable people are with having a machine giving them a diagnosis, or letting them know that a machine made their decision for maybe their medication or the treatment that they required. So for my future work, I would like to do sentiment analysis online for people's feelings of machines versus doctors, because I feel like that is very important. Because although in the study the neural network got a higher F1 score, that doesn't necessarily mean that people would A, understand what that means, and then B, would be okay with a computer making decisions that could potentially affect their life forever. Second, try to classify other diseases with high accuracy using machine learning, similar to this project. And also try to get a better score with my current model by through acquiring more data and um, changing hyperparameters and things of that nature. So thank you for your time, and I hope you enjoyed the presentation.